We were selected the most improved large hospital for patient satisfaction scores. That was amongst all hospitals in the nation. To get an award that says, you guys have really improved and we notice it, makes a big difference.
Well, you know, Fort Worth is a big city now, 833,000 people, and to be there, you have to have a medical center that reaches out and touches all level of people.
You look at Tarrant County, we're gonna have 2 million people in no time. And you know, with growth, you've gotta have facilities, infrastructure, and everything in place. If our health network isn't strong, it's not good for our whole community.
One day this community will say, thank God JPS was there for what is today my mother and my father, but tomorrow is me, and in the future is my son and my daughter.
John Peter Smith is championing that commitment to wellness and reaching out all across the county with clinics, with education programs, partnerships with the other hospitals.
Now we have new residency programs, and it's growing and growing to take care of the needs of healthcare in Tarrant County and in the region now.
When I started as CEO here, our daily census in our emergency room was 175 people a day. Today, our census is probably going to be 380. We have got to grow. We've got to continue to figure out how we expand an ICU and trauma care and an ED.
An additional need that we have is related to workforce. The Bayroth workforce there's significant shortages across the state of Texas and honestly across most of the country.
So as the patient population grows, our current number of providers would not be able to handle that capacity.
There is a real need to make sure that that facility meets the needs of today and tomorrow of Tarrant County. And right now, it can't meet the needs of tomorrow.
We've got more people coming through than we ever have before.
We're growing by 5% every year, and our hospital beds aren't growing by 5% every year.
We're making a difference. We can see the needle moving a little bit, but there will always be more that we need.
If more resources were available, we would be able to add on other providers, expand our service line into other parts of the community as well.
Not all of our need should and can come from a tax dollar. Our foundation needs to ask this community, can you give? Your local tax dollar is 40% of our budget. We've got 60% to come elsewhere. Help our cause, which ultimately could be your cause. Help us have a better building because you may be in that building.
And so we try and think through and make what we call win-win-wins. Wins for the patient, wins for the hospital, and wins for the taxpayer.
They take care of everyone with the resources that they have. So imagine if more donors and more people came to support this organization with more financial resources, imagine the greater impact they could have in the community.
I hope to see JPS be the place that everybody wants to be taken care of. Not only will you get outstanding care, but you will get outstanding compassion.